I'm so excited about this month because it's talking about women and their breasts. It's a very sensitive topic, and I have here with me an amazing nurse, a guest actually, to have this conversation. So if you haven't tuned in yet, kindly do go subscribe, comment, like, and share. Follow us on all social media platforms at Breaking the Gist. On Instagram is breaking_the_gist. On TikTok is Breaking the Gist. Let's get right into it. Welcome back. It's still Breaking the Gist right here with me, Miss Angie Bell. We are right here at Gist Studios where we bring you all the latest, hottest, juicy vibes. Today's discussion is intriguing, it's educative. If you haven't subscribed yet, please do kindly subscribe, like, comment, and share to your loved ones, okay? Because the game is about to begin. Let's get right into it. So my beautiful guest seated here will introduce herself, then we start this amazing conversation. But before that, today's topic for discussion is myth and misconceptions about breast cancer. You're very well, right?
Yeah, very well.
Yeah, I can see that. So our audience would like to know your name, what you do, and more about yourself.
Well, my name is Phyllis. Phyllis Awatri, midwife. Well, a midwifery officer with Health Talk Limited at Pokwase.
Okay.
Yeah, that's what I do.
That's all, yeah.
Basically.
So she's a health practitioner and a midwife, to be precise. So on today's topic
Always
for
at your
discussion,
service.
always at your service. So for today's topic for discussion, breast cancer and its myth and misconception. What is breast cancer?
Basically, breast cancer is an overgrowth of the cells. So the cells grow abnormal. So then it turns into it becomes cancerous. That's how come when it overgrows, it forms lumps, and then the lumps become cancerous. That's not to say that every lump in the breast is cancerous. No. So the overgrowth of the cells in the breast forms cancer. I don't know if you get it.
Yeah.
So based on your lifestyle habits, based on your family history.
So we'll come there. Oftentimes we tend to hear that I have this auntie in the family who has, is it hereditary?
It actually is. It's very hereditary, if I should put it that way. And it doesn't also mean if you don't have any relative who has had breast cancer, then they are free, so you can just go about doing anything because my mom doesn't have it, my auntie didn't have it, my great someone never had it, so then you're not going to get breast cancer anymore. Times are changing. The food we are eating now is quite different from the food our parents ate. So that alone could predispose you to breast cancer.
So with breast cancer, what are some of the early signs you can detect as a person, even at home, before you even go to the screening centers and all?
The skin surrounding the breast, like this, the breast, the skin, there's some kind of dimpling. You see the way the orange peel is, those dots. So you see that the skin that's around the breast starts to dimple. Some small, you might think it's a pimple. You might see discharge from the breast, especially if you're not breastfeeding and you're seeing discharge from your nipples. Then you know that something might be going on. All these, it's not 100% sign that it is breast cancer. It could be something else that is happening to the breast. It could be an infection. It could be anything. Like I said, it could just be a pimple that I decided to follow the breast.
Yeah. So what are some of the common risk factors for breast cancer? The risks involved as a person. Should someone who is seeing these signs, should they be scared?
No, you shouldn't be scared. Like I said earlier on, it doesn't mean that so long as you're seeing dimpling, you're seeing discharge, you're seeing the pimple, you're seeing the scaly skin and all, that doesn't mean that it is breast cancer. Just know your body. So maybe this month you decide to stand in front of the mirror. This is my breast. This is how it is all the time. But you realize that it looks like before the left used to be bigger than the right. But you stand in front of the mirror and you realize that this time my right seems to be way bigger
Bigger.
than the legs. It could be something else.
Else.
It doesn't justify that it is breast
Mhm,
cancer.
mhm.
So you need not to be scared. Just go to the hospital.
Hospital.
They'll run you through some tests and then it will be confirmed.
So this brings me to my next topic. Like you were saying, some one breast can be bigger than the other. Is there a deformity? Because some ladies often think it's a deformity to have one breast bigger than the other, or even one ass bigger than the other.
It's never a deformity, honestly. It's actually normal that one breast will be bigger than the other.
But oftentimes,
But
what
not
causes
too big that I see now I can tell which
that?
breast is bigger than the other. No.
Oh, okay. Wow. This is amazing. So, what lifestyle changes can reduce somebody who has breast cancer? What lifestyle? What are some of the things she can do?
For someone who has breast cancer or for someone who is not
Someone who has breast
someone
cancer.
who has breast cancer. So because of the treatments that you be going through, it's not advisable for you to be taking alcohol, be smoking, taking in so much caffeine, taking in sugary foods. I mean, your lifestyle needs to be, especially your diet, whatever thing that you take in needs to be on point.
Okay.
Like it should be very healthy. So that is for someone who is who has breast cancer. But even if you don't have breast cancer, you should still make sure that your lifestyle is on point. You're not drinking too much, as in you're not taking too much alcohol. You're not smoking. With the way now we see our ladies doing their shisha and all, at least
It's possible to cause breast cancer.
Of course, there are lots of chemicals and very dangerous substances and stuff like that. So it gets inside your body and this go and knock this and then it creates.
Oftentimes we have this myth and misconceptions out there that when men do suck the breast, or a man who has tooth decay or maybe infection in the teeth, when they suck the breast, it often causes infection in the breast or breast cancer.
Well, with the infection, yes, but breast cancer, no. Infection is when he's sucking, he bites, it causes some cracks around the nipple, and then maybe a bacteria enters into that crack, that opening, then it causes the breast to be infected.
Oh, okay.
So there's a condition called mastitis. So that is where it will give you issues. It doesn't mean so long as he's sucking on your breast, then he's biting, it will cause breast cancer.
Oh, okay.
And so I'll use this to advise our men, our guys, our husbands, our boyfriends, our sugar daddies. That's fine. You'd want to play around the breast, but I mean, take it cool, take it gentle. No chewing and
using the teeth and all that.
Why would you even use the teeth? To suck breast.
To suck, like,
how can you suck with the teeth?
I think we have to we have to get a real live video of how to suck boobs, because some men don't really know how to suck the boobs. It's a very soft. Our boobs are soft, and then the tissues in it and all that. So you have to handle it with care, because well, does excessive sucking, does it have any how do you call it, risk factors to the breast?
No.
Excessive sucking. Sometimes they'll be like, is it possible?
No. It's not. It's not.
So
it's in no way related to saggy breast. There could be people that have. You see, it depends on the individual, the woman. Every individual is unique.
Yeah.
So probably the tissues in your breast are not so strong, if I should put it that way. So as time goes on, as you age, definitely we used to be quality no so better. Good.
Okay.
So you don't expect that you be playing with it, sucking, you give birth, baby sucks, no comes out, it stops, husband is still
sucking,
and how your breast was when you were 12, you really don't expect that it will still be the same way when you are 40. So it's with aging, and I mean, as you grow, like I said, as you grow, the tissues and everything becomes more relaxed. than they were
But you
when they were
mentioned as
younger.
you grow, but then you can meet a girl who is like 19, 20, but is having like saggy boobs. Someone who is hasn't even given birth before. Somebody who doesn't have a husband, but then boyfriends. So it means that sucking excessively can cause that
No,
because. Mhm,
I wouldn't agree to that point
mhm.
actually. I wouldn't.
So what
It's
causes
not
what
as a
causes?
result of the sucking. Maybe that's the natural. That's how the woman is.
Mhm.
I don't know if I can say this, but you also
You can
see
say everything.
people that have their ads very soft and falling. There are people that have very strong rounded ass.
Mhm.
So would you say it's because their boyfriends have been pressing it so much? That's why it has become very
Very
soft.
so. Okay, so it's just a
It's
misconception. Wow,
That's the
it's just
genetic
a
makeup of the
misconception.
person. So it's not because of sucking. No, not at all.
So how does breast cancer treatment affect the person in the long run? You have breast cancer, you are treating it for years. What are some of the risks someone should look out for if you are treating such a condition?
So some of the risk you can look out for. So chemotherapy is because cancer cells are very troublesome. The drugs that are used for chemo are also very strong drugs.
Okay.
So they're aggressive. Let me put it that
Mm-hmm.
way. So whilst they are targeting the cancer cells, they could be having an effect on you in the long run.
Mm-hmm.
So mostly what we say is sometimes when someone has breast cancer and we lose the person,
Mm-hmm.
it's not because the person had breast cancer. Okay, well, maybe it's because the person had breast cancer,
Mm-hmm.
but it's more because of the medications that the person was
Person's
on.
okay.
For all you know, the person's liver, kidneys were not in their best position. So when the chemo drugs are also given to the person, it makes the condition worse. It puts so much pressure on the kidneys and the liver
Oh, okay.
because whatever thing that's ingested into the body, the liver and the kidney suffers it more
Mm-hmm.
because the liver does the breaking down, whatever. The kidney also does the filtration.
Okay.
So if it's something, a substance or a chemical that is very
Mm-hmm.
aggressive, then you know that obviously all the pressure but so so
Wow. With breast cancer, we forgot to address this issue. Is there an age limit for someone who is possible to get breast cancer? Because can a
no.
5 year old like old get breast cancer? Can a 2 year old like we just want to know?
So there's no age limit, but in nursing or in health, we consider the reproductive age to be from 18 to 35
Mm-hmm.
years. So when you're within those age, that gap, it's ideal that as a lady from 18 to 35, you should have been done with childbirth. But with now,
Mm-hmm.
you might be schooling, you don't even have work.
Work, you know.
How are you going to have a child? How are you going to take care of that
Mm-hmm.
child? So then it's prolonged. Then some people also have their period. They see their period at a
Very
very early age,
okay.
which means there could be some issues of hormonal balance.
Mm-hmm.
Maybe their estrogen levels are way too high because when the estrogen levels are high, it also sort of fuels some of the cells that are overgrowing to
Okay.
become cancerous.
Mm.
So the age limit, yeah, I wouldn't say there's an age limit, but the ideal, what we usually say is persons that have their first menstruation very early, and then persons that have their first child after 35
Mm-hmm.
years, you are at risk of breast cancer because of the hormonal imbalance.
Imbalance. Oh, okay. Okay. So with breast cancer, we only hear about the women aspect, but I want to know the men as well. What are some of the risks involved? Because can a man get breast cancer?
Yes, they have breast on the
Of course they do. So
yeah, they do.
normally we call it the chest, but then we didn't know it was like breast.
Chest,
Mhm.
but there are nipples, so
Mhm.
obviously there's breast.
Breast. Mhm.
Except that they don't have so much tissues
Tissues there.
around there.
Mhm.
That's how come it's not as big as you see on women. But
Mhm.
yes, men do get breast cancer. They do.
Mhm.
It's very rare. say you take about 100 men, it's likely you get one man that has breast cancer.
What may cause that? What may cause the cancers in the
Family,
breast?
lifestyle. So the family history, the lifestyle. So long as it's in the genes, the cancerous cells are in the genes. Definitely,
Wow.
you might get it, especially if you don't watch yourself well. So it's like with BP and then hypertension and then diabetes.
Can cause breast
So you
cancer for
know
men.
you have you've heard that, oh, my uncle had diabetes, my mom had diabetes, my greats whoever had diabetes. If you don't check yourself well and you go about eating just anything, taking in sugar, taking in anything, obviously you're going to get it. But the truth is, if you check yourself, especially with a
Lifestyle.
and you check yourself right, there are some family history of illnesses that if your lifestyle is on point, you wouldn't get.
Wow.
So yes, the men get it mostly because they have the genetic history.
Yeah, but what are some of the foods we should avoid? Because Charlie, this the world we find ourselves, we they eat everything, all the junk foods and everything, but we are not even paying attention to our health. So as men and women to avoid breast cancer, what foods do you advise, or what kind of the things we can be doing, exercises and all that?
So we can reduce the intake of spices, especially these modern spices. I'm not saying we shouldn't buy. I don't want to mention names. I'm not saying we shouldn't buy them,
But we should
but
reduce the
I'd
intake.
advise that if you are cooking, try and then incorporate as much natural spices if you can. I mean, they're not even expensive. But now we eat Indomie. The Indomie now is flour. Then we add spices.
Stop.
We don't know where they get those spices from. It's just inside the rubber. We just pour it in. Some people will do it with just little vegetables. So in that case, well, you can take it, but you make sure that what you are eating, the bad should be something small. There may be more vegetables, more protein, and even how the protein is cooked should also be checked. So if you are using meat, say minced meat, and you're steaming it, you're cooking it, you don't go and buy
the junk one.
and just come and put it inside. Oh, I want to tell you, I have to get to work at 7 and it's 6:30 and it's 6 and you're cooking. You need it like you want it early. So in that case, what you can do is you can get some maybe garlic, ginger, turmeric, cinnamon, all those natural spices. Get them blended, store them in a freezer, store them in a fridge. So if you're in a hurry, you just take your meat, take your fish, chicken, whatever it is. Take a kaguswa. Then you
So how often should a person screen their breast? We realize that breast cancer awareness month is October, and then does it mean that every October you should get your breast screen, or you should 3 months, 6 months? How long?
So that's where the problem is. Many ladies, many women, or females in general, when you ask her, hey madam, when was the last time you checked your breast? Or last year October, they came to our church and then I got it checked. October is breast cancer awareness month. Doesn't mean it is only in October that you get your breast screened. No. So we advise that every month after your period, say about 2-3 days after your period, you get your breast examined yourself. You don't need to go to the hospital. If you're fortunate to have a nurse friend or a doctor friend, then the person can help you get checked. But you really don't need to get to the hospital. Before you bath, obviously you'd take your dress off, stand in front of the mirror, then you go through the self-examination. Just place one hand behind you. Just even if not necessarily going round, start from the armpits because some of the breast tissues actually are originated from the armpits. So sometimes, another one, you might be getting a lot of boils around your armpits, like in your armpits. If it's too much and your instinct starts giving you some unusual feeling, you could easily go to the hospital.
Okay.
Tell the doctor, hey, I've been getting so many labs. He'll write some labs. If it's not any bacterial infection, there's no yeast, there's no nothing, and you're fine. Then he would move on to getting your mammography, like an X-ray of the breast.
Okay.
They'll take some tissues out of the breast, take it to the lab, and also check if there are any cancerous cells. If it is clean, then I mean it's just something else.
Something wrong. Yeah.
So with the self-examination, like I said, you stand in front of the mirror. First of all, you check. Okay. So this one is usually slightly bigger than this. That is normal. You look around. The skin is fine. There's no dimpling. There's no pimple. There's nothing. There's no rash. There's no reddening. There's no discharge from the nipple. They are fine. So you can start from either side. So if you're starting from the right, then your right hand is placed at the nape of your neck. Then you just move round.
Okay.
Just move round and then check if there's a lump. Like I said initially, if there's a lump, it doesn't mean
you have
it
breast.
is cancer. So don't say, there's a lump, and you become so moody and so disturbed, and you don't even move on to the next breast to check if there's something wrong with it. So you just observe if there's a lump. If there's a lump and you're not okay with this, just finish with your bath and then dress up and see a doctor. So when you're done, come to the nipple. So the black side, that's the areola surrounding the nipple. You press it downwards. So holding it, you press it downwards, hold, and then push up. So if there's any fluid, you don't just hold and press. No, what
you don't just hold and press. So do it yourself. Don't let your boyfriend do it for you yourself.
Oh no, he can do it too. Guys are watching.
Because when you start doing this, you end up somewhere else.
So you would. So assuming this is it.
Like,
so anything that is there will come. So you did that for this, then you did that
for
the other one too. So if it's right, the right is behind, the left does. If it is the left breast, left is behind, then the right does.
So
every month, you don't do it before your period because most ladies before our period comes, we feel pain, some discomfort,
heaviness, and all that.
Good. So you might assume that the way that my breast is paining me right now, then there's something wrong. Then you start shivering. You won't eat again because
dramatic
you are scared.
ladies.
Thank you. So it's advised that every month we get checked. Not only on breast cancer awareness month. No, not only in October. No, not at all.
Often.
Very often. And your boyfriends too can help. With the sucking, maybe he's sucking and he realizes that this my girlfriend is not breastfeeding. So where from this thing that's coming out of the nipple? So and you see, because he plays with it more often, if there's a lump, he's able to tell.
Detect, okay.
So maybe you're not able to do it every month, but maybe this last month you did it, you were fine. This month you've not done it too, but boyfriend is playing with your breast, and then you realize that Charlie, something is inside today. Let's get checked. So yeah, the boyfriends also help. Just don't go chewing the nipple. That's not nice.
Don't go chewing it. So with early detection actually, what should a person do? Aside rushing to the hospital, let's say people oftentimes go to the pharmacy to get ointments. There are ointments out there. They said if you have what. I don't want to mention their names, please. You actually apply it so that the pain can. Sometimes you feel pain, maybe after your menses, or probably you detected that there's something wrong with the breast, and then you want to use ointment. Is it advisable? Those ointment doesn't work. Why should one not use, or why should one use?
Well, so when it comes to the breast, when it comes to the vulva, when it comes to your eye, even your ear, you don't just, there are things that if you lose it, life will be miserable. So you don't just walk into any pharmacy, or you don't sit in a car and hear someone say, now no for cry now hold on yeah me wa ointment way no. You don't joke with it because it can cost you a lot. Just go to the hospital. Fine. Now, I believe a number of us would have doctor friends, a number of us will have nursing friends. Just call them. I mean, someone you trust, someone who will not going to be talking. Just call the person. Oh, Charlie, I was doing this examination and then I realized that my breast has become very painful, but I've already had my period. I don't know why my breast is still, like, I'm feeling discomfort. Can I come? They'll even schedule a meeting with you. You don't really have to go through the line. Maybe they just take you to the lab guys, then they'll do whatever they have to do. I found my nurse friend, so you should find yours. So they'll take you through all the tests that you need to go through, and then you're good to go. Yeah. So with treatment of breast cancer, does it affect fertility? You being a midwife, I'm sure you can throw more light on that. It doesn't. No, there's no scientific research to like 100% say that treatment of breast cancer will affect fertility. But in certain instances, it affects your hormones. So like it causes an imbalance of hormones. But if really your fertility, you've had breast cancer, maybe you're married, maybe your boyfriend and yourself want to have a child now, but you've had breast cancer say 2-3 years ago, you went through chemo, your hair fell off and all that, but now you've recovered completely, and then you want to have a child, but you're finding it hard to conceive. You could go to the doctor, go to an obstetrician gynecologist. They'll check your hormonal levels. If it is low, there are other medications that will help to balance it, and then you're good to go. Well, so it's likely to affect fertility. Yes. With your hormones and everything. Wow. This is really intriguing. I hope you guys are really watching because I've learned a lot. I've really learned a lot. Do you have a lifeline to call, or probably you can book a doctor on the phone or something? How is that? Because someone is shy. Breast is a very sensitive part to talk. How can I go and sit in front of some male doctor, fine male doctor, and talking about my boobs? No. So how can one communicate? Is there like a lifeline out there? The whole thing about breast cancer. That's why there's breast cancer awareness month. So usually, if you have issues like that during this month, there are a lot of hospitals, there are a lot of NGOs or organizations that offer this free health screening, breast screening and awareness. And so they do the examination for you. They realize maybe there's a discharge. They realize there's a lump, and the lump might be painful. They realize, I mean, they say something unusual about the breast. They ask you, and it's true, yeah, I've been feeling it or I've seen it, but probably you did nothing about it. Then, usually, when there's a health screening, they've liaised with a hospital. Okay. That may be, okay, so we've written the referral for Madam Phyllis. So, should she come? The name is there. Maybe it's breaking the gist health screening. So, I have been referred. Oh, Breaking the just organized this breast screening and examination. Yeah, we will be organizing one soon. I went and then I've been referred. So there's some kind of discount. If sometimes you don't even pay anything at all. Oh, okay. The mammography is free. So long as you passed through that. But it also doesn't mean, okay, so October is past. November, you did a self-examination, you realize there's something unusual. Media, I don't have money. So let me wait till next October. Hey! Dear, you'll be killing yourself. You could speak to a psychologist or a psychiatrist, a mental health nurse. Just find one of them, talk to them. Don't be shy. Fine, people will talk. People say that, see, she's talking to this mental health nurse. Probably she's going crazy. Don't mind them. Just talk to the person. Tell the person your problem. They are more equipped, and then they would find ways and means of helping you. If it is financial, see that.
Don't wait.
No.
Make sure you check your breast every month, every month, every month. Don't let your finances detect what is going on in your body. Is there any areas or factors we haven't discussed as a practitioner that you can advise people watching out there?
Yes. As women, we should. The young ladies now. Me there, when I give birth, I won't breastfeed my child. Though. Hey, me I should breastfeed my child so that my breast will sag and my husband will leave me. Share. I won't do. No, we don't do that. It's not right. Actually, breastfeeding and breastfeeding well, properly, exclusively for 6 months. After 6 months, don't stop. Continue. But I mean, you definitely be adding other foods. It reduces your risk of getting breast cancer.
Oh, okay.
By about 20%. So don't say because you don't want your husband to leave you, you put your health at risk. Women, be a man that will see you and appreciate you for who you are. If you're not comfortable with something, please don't. The after pill. The after pill. It should be like twice in a year.
So, the lady, I know.
Yes, the lady.
Twice in a year.
Yes. Twice. Because for it to be able to stop fertilization.
Yeah.
So if you're taking it like every 2
like
weeks
para.
or every week, or every week, then you I mean, you're causing yourself a lot of harm. Fine, you can't abstain. There's no problem with not abstaining, but you can go in for a family planning method. The guy will obviously say that he doesn't want to wear rubber. Take responsibility of our lives. All the post pills, my husband, sometimes the men even say they don't want their wives to breastfeed because the breast is going to feel softer than it used to be. I mean, just keep it at the back of your mind that breastfeeding, okay, if I breastfeed, it reduces my risk of getting breast cancer by 20 good percent.
Wow. Is it advisable that while you are a lactating mother, you are breastfeeding, your husband or whoever should be sucking your boobs and enjoying the milk meant for the baby?
So I'd say yes. He can. I mean, if he wants to take breast milk, it's up to him. But for women, that's so there are some people that after delivery, it takes a while before the breast milk starts to come.
Okay.
And sometimes I don't know, but for some reason, the children do not really know how to suck. And so the nipple is not stimulated well enough for breast milk to be produced. Then the man can come in.
Okay.
So when he does the sucking, it's like he's just stimulating the nipples for breast milk production. Okay. But if breast milk is coming and he still wants to suck,
you should leave them. Let the men breathe. Yeah. Wow, thank you so much. So fast forward. Surgery, breast reduction or breast enhancement, does it cause breast cancer? Does it cause anything like infection to the breast?
So it increases your risk of getting breast cancer.
Okay.
That's all I can say. It increases your risk of getting breast cancer because especially breast enlargement. You're enlarging the breast when you've not touched it, it has the tendency of overgrowing itself and it causing you issues. And when that has not even happened naturally, you are trying to make it bigger. Obviously. So usually what I know is those that do this breast enlargement and all, they are on medications. Like they are still being taken care of because it can do you harm.
It can do you more harm than good, right? And the product is sold on the net or around for breast enhancement. These ointments, these medications to make the breast bigger or smaller. Does it also have a very high factor?
It does. Those ones, even if it won't cause you breast cancer, it's too much on the liver. It's too much on your kidneys. That's why now this whole kidney failure and liver failure and all is increasing among the young. So first it used to be, oh, this man is like 50 something, 60, and he has kidney failure. Obviously, he's 60. Like, he's been eating, he's been taking medicine, he's been drinking water from some river, he's been doing something. I mean, he's done a lot for 60 years. So if his kidneys are failing, kidney no abre. But nowadays, you get people like 13 coming for dialysis.
Wow.
Even the fertilizer. That's why I'm saying even the food we are eating is not doing us good. So why would you, the individual, decide to add to the harm that is already being done to the body? I don't know if you get what I'm trying to say. So the tomato you're buying is fertilized, chemicals. It's not good. The cabbage you're buying, it's fertilized. All that's fine. You cook it, you wash it, you try and then make it neat enough to be taken. You've done well. And then you finish and you go and buy flat tummy pills, but how do they even call it? Butt enlargement. And why? Like, it doesn't help. Even if it doesn't cause breast cancer, it might do you some other harm.
Okay. Wow. So this is a segment you've all been waiting for. It's coming. The hot seat. So Phyllis here will choose about 50 questions and she will answer for us.
I open or you open?
So you open, then you read it out.
Have you ever snitched on a loved one before? No.
No. No.
No.
Okay.
I wouldn't want that to be done to me.
Oh, so you are those people. What shouldn't be done to you, don't do it to me. Period.
What killed your feelings for someone? Bad English.
Bad English.
Like bad.
Like very bad. Pidgin or what?
No. Oh no, not pidgin. Bad brothel. Very bad.
So could your feelings die for the person? Hey!
I mean, boys, then when I take you somewhere, maybe you have a dinner and then you're going to talk and you start pouring English on the floor. What's a red flag in a guy? Red flag. I mean, you were red flagging.
Madam, don't let me wound you here.
My red flag. Bema undressing. I mean, you should know how to present yourself.
The son can you cheat? I said, I cheat.
What will you do if you find your partner in bed with another man? So with another woman? Well, leave me.
Hey, well, not no second chance.
No.
Why?
Second chance? No. I'm not a church. No.
I'll say I'm choosing.
What's the most valuable present or gift your partner has given you? His advice. My ex, actually.
Oh, so that's why I don't want to say the biggest lie. You see? Fear women, oh. Fear who no fear women.
What did you learn from your last? Never to trust a guy.
Fear men.
The same person that advised me.
It go over you.
Not to trust him.
Men.
What's a Hey, this question.
Hey, you will say it, or you're not leaving the studio today. What's your wildest dating story? Hey, this something you're smiling like this. What's your wildest dating story? What is it? What is it? I'm all ears.
Yeah, I told you.
I don't want to hear. If you don't say it on Breaking Edges, I'm not hearing it behind the scene. I don't know you.
But remember, I told you
I know your papa
before.
before.
I told
Please.
you. Yeah, I told you.
Please say it. I don't want to have serious issues with you. I'm listening. Don't miss my ears. You see, boys got lie.
Oh. Hey, how many are we thinking? I'm not catching.
Hey, why are you counting? In fact, who is counting?
Can you? Nah. Can you donate your kidneys to the person you're currently dating? If I say no to it, he will touch me and I said no. But no.
There's a reason why it's two. Are you aware?
Dating, no. And what superstition were you forced to believe that when you're bathing and you sing, your mother will die?
Hey, is that what they said?
Yes, so.
Hey.
And
I thought they said dwarfs will come into the bathroom or something.
They said your mother will die. So whenever I'm singing, I'm bathing, I hear music.
You still believe it?
Oh no.
Of course.
I'm a big woman now. What moment in your past do you wish you could experience again for the first time? Moment in my past. Which one should I even say?
Say everything. Your all ears. My ears are itchy. You want to know?
I think the first time I was kissed.
You want to relive it again?
Yes.
The feeling, how you felt.
Nice.
Aww. Please, I didn't hear. Say it again. Say it again.
No, I'm done.
She said the first time she was kissed. Last one.
Ish.
Last one.
I get the 50. My favorite childhood memory was when my father got me a bicycle because I said I wanted to learn how to ride. And he said I was a lady. And unfortunately, I didn't have a brother. But I still don't know how to ride a bicycle.
But didn't he get it for you?
He did.
So why didn't you learn it?
I think I learned it, but I never rode after that time. So unbelievable.
That's unbelievable. Anyways, it's been exciting. It's been fun. I think I love today's episode. If you're watching at home and you are wondering what we are discussing, it's still myth and misconceptions about breast cancer. And then our nurse here, Phyllis, our midwife, actually.
Always at Phyllis.
Yeah, actually gave us the talk we all needed. I've really learned a lot. What are your last words to somebody watching or listening as today who doesn't have it, or who possibly has seen the signs and everything, or who even has it? What advice can you give someone like that?
So my last word to be that we should try as much as possible to get the self-examination done every month, about 3 days after our period.
That's someone who hasn't seen it.
So that's for someone who hasn't seen anything, just to be sure. And for someone who has it, the trauma psychologically is huge. It's a lot. Just push yourself through and know that so long as it is detected early, your chances of survival are very high. So just relax. If you need someone to talk to, contact Madam. She'll get in touch with me and then we'd help you. And for someone who has recovered, congrats. You've been through a lot. We are with you. Keep checking. Keep spreading the word to the other women. And to women, let's take responsibility of our health. Let not your husband or your boyfriend or your father, your uncle, whichever male
Figure in your
figure
life.
in your life decide for you. Make informed decisions. If you don't understand anything, you can even ask your fellow women to help you and decide for yourself. That's what I have to say.
Decide for yourself. Once again, it's Breaking Edges right here with me, Antiville. It's Breast Cancer Awareness Month, everyone. We are still spreading the news. Please, please, please go to your nearest health center right away to get checked. Like she said, don't wait till it's October before you check. Check every month. But then this month is purposely for detect, how do you call it, for checking and everything. So please, 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 wherever you are, whether you're a male or a female, as she said, male, you can even, as a male, you can get breast cancer. I hope you heard it. So please go to your nearest health centers and get your boobs checked. Okay. Yeah, thank you so much for joining on today's episode. It's been fun, it's been training, it's been very educative. If you haven't subscribed yet, please do subscribe, comment, and share to all your loved ones. It's still Breaking the Gist with me, Miss Angelo. Follow us on all social media platforms. On TikTok is Breaking the Gist. On Instagram is Breaking the underscore gist. Yes. So follow us there and keep our pages interactive. It's a bye.